Okay, I'm so sorry for the 2-minute delay. For some reason, my slides were being hidden, and I don't know why. PowerPoint decided that I needed to hide some slides. So we are ready to go. So open office hours. It's let's see, it's April already, April 5th. So this is open office hours every Tuesday at 6 p.m. I do open office hours in my Facebook group. So again, 6 p.m. Apologize for being late today because of the PowerPoint. So education, the first 30 minutes is really just a webinar format for a different topic, all kinds of topics that I've done so far. This week is about anxiety and a holistic approach to anxiety. And then at 6:30, those that are in my membership or in my practice are invited to go to the Zoom link that you have from join the practice. And then we just have a 30 to 40 minute chat about whatever you guys want to chat about. I've talked about the presentation, and we've had conversations about all kinds of things that I can support people. So if you're in the practice, then join the Zoom link after we finish. So again, this open office hours, if you join us, they're always voluntary. It's really about not judging people's questions and really trying to support each other. I really, really believe in the group visit concept, which is to help each other out with trying to make suggestions and see what worked for you, what doesn't work for you. And it really does help to have accountability. So the rules are just be patient, polite, considerate to the other people in the group. Why am I doing this? Well, I really believe that healthcare should have a component of just health visits with, doctors and chiropractors, acupuncturists, nutritionists, sort of the health care model. And I believe there should be a community. And I also believe there should be resources for patients who want to seek holistic options. It's about choice. It's about knowing what your choices are for what you're trying to do. So again, it's about all of these things. Let me just make sure my audio is hooked up. Perfect. Okay. All right. So I'm going to talk about anxiety. So I know I was going to talk about the Dutch testing this week and hormone testing, but I saw 3 patients this week and it was all related to anxiety. And myself, actually, I had 3 nights where I could not fall asleep. It was 10 o'clock and I was just wired. Now, if you have PCOS, it's pretty normal that you kind of have these sort of wired and tired feelings where you're wiped out during the day and then suddenly you're trying to sleep and you can't. So I thought, it's good. Let's talk about different approaches to anxiety. Because I really think that, it's really a more complicated picture. And so there should be options that sort of address the integrative approach. So the first thing I want to say is it's not about getting off medications, because there are patients that I see in my practice that I use both medications and supplements and herbs together. And the goal ultimately is to be able to be off of medications, because you try to find out what's causing someone's anxiety. What is the root cause of their anxiety? Because anxiety doesn't just stand alone. There's usually some reason why someone's having anxiety. So understanding how you can blend both traditional medications, supplements, herbs, mind-body practice, all these things, nutrition, and sort of figure out a bigger picture for someone is really what I'm always trying to do, is help people see all the different options, and then they can kind of decide what works for them. So how is that different? Really, you got to take a good history to understand what's causing someone's anxiety. You have to figure out, you got to spend time and talk to people. This is the one thing I didn't like about private practice when I was there, is I only had 5, 10, 15 minutes at the most. And I really couldn't ask the questions. When did it start? When do you have anxiety? Is there a particular event that it related to? How is your diet? Do you practice any sort of mind-body practices? What do you want? Do you want to be on medication? And there's so much more to sort of just spending some time with a patient. That's why my visits are 1 hour. I also feel like it's more than just sort of a doctor saying, here's the medication and here's a therapist. Sometimes it's related to their nutrition. So they're having nutrient deficiencies. If someone has a vitamin D and vitamin B12, if you don't fix that, their anxiety is never going to get better. So it takes a team of people to help them address their anxiety. And yes, I had one patient who had a very low vitamin D of 9. She fixed it and her anxiety went away. And believe it or not, nutrient deficiencies is a very common cause of anxiety. So anxiety is really common. I should have said 10 to 15%. of the population, there are a lot of subtypes of anxiety. Generalized anxiety, those are sort of the people that we talk about, the worriers in the world who just worry about everything. OCD is a particular type of anxiety, panic disorders, PTSD, and all are marked in the DSM criteria by irrational, involuntary thoughts that the patient can't control. They can't control these things that come into their brain. And oftentimes people have signs and symptoms of anxiety, not just what you sort of think about, but also can be fatigued, restless, they don't sleep well, they're irritable, they can't concentrate, they have brain fog, it interferes with their ability to have relationships, to work. And oftentimes it's also corresponded to other comorbidities. Believe it or not, 40% of IBS patients also have panic disorder. There are a lot of correlations with women who have endometriosis and depression, PCOS and depression. You have 4 times more likely to have anxiety and depression if you have PCOS. And so there's a lot of sort of comorbidities that come with it. And when you look at it from an outside perspective and you say, why are there people having so many things that are associated, like actual medical conditions that are associated with anxiety, you have to wonder whether or not there's a cause for that particular thing. What can we do to identify what's causing someone's anxiety? And a lot of functional medicine, integrative medicine, and conventional as well, believe that really anxiety is a symptom. It's a symptom of inflammation in the brain that disrupts the actual signal that, the neurotransmitters that tell your brain how you feel, how to respond, tells your hormones what to do, that the inflammation causes a disruption in these. And so that's the symptom is anxiety. Really, no one really knows what, like you can't say this one thing causes anxiety. It's so multifactorial, but we do know that part of the brain, the amygdala, is a big part of it. As to, when we talk about brain inflammation, is really responsible for the area of the brain that sort of has this dysfunction in neurotransmitters. And so this is kind of a really important slide, because when I talk about inflammation, there's so many causes for inflammation in the brain. And I'm going to sort of mention this when we talk about the functional medicine, the integrative medicine approach to anxiety. But there's a lot of reasons why people can have inflammation. And it could be head trauma. It could be that they have a medical condition like they're anemic, or they've had a prior stroke, or some sort of Alzheimer's patients, things like that. Certainly drug abuse and alcohol abuse can cause those issues. People with blood sugar issues like diabetics. A lot of things can cause the brain inflammation. And once the brain is sort of inflamed, you see these symptoms, which I mentioned already: brain fog, poor ability to concentrate, fatigue, just overall feeling poor. And this sort of illustrates what we're going to talk about, which is the causes. So once the microglia are the little cells in the brain, and once they get activated or inflamed, they start causing all these downhill problems. So they can cause the conduction in the nerves that don't signal appropriately, that tell your brain what to do. So sometimes this has to do with perception too. So if you feel like something is a threat, I've had patients who've told me, you know what, I feel like, say someone puts a sock on the ground and they're like, why is this sock on the ground? Why is this happening? Why did someone do this to me? And it's this perception of what is happening around them, when the other people in the room might be going, it's just a sock. I mean, nothing was intentional. And it's sort of this inflammation can kind of cause the perception of what's happening, which leads to these downhill symptoms. And we're going to talk about some of these kind of causes here. I sort of vaguely put this in the slide, which is, diet, certainly the gut microbiome. This is really important this is so many new studies now, and so much science that's coming out with the gut-brain connection, and how much the gut really controls what happens in the brain. If you look at studies on mice that actually look at the gut, like how well their gut health, the microbiome of the bacteria in their gut, and which ones had sort of a poor gut health and which ones had a healthy gut microbiome, you can see that the rates of depression, anxiety, and all kinds of behavioral issues, all kinds of things that really is interfering because of the gut health. And then you have things like pollutions, infections, toxins, and then we'll talk about sort of the stress, the oxidative stress inflammation pathway too. So the conventional approach, and I think I mentioned this before, was the conventional approach is really about medications, about symptom driven. If you have anxiety or depression, let's talk about, is it anxiety? Is it depression? Is it a combination of both? And then we tailor our medications based upon that, because there are certain medications like SSRIs, Paxil, Prozac, Celexa, Lexapro, all of those that are geared towards both anxiety and depression. And then you have medications like Effexor that are more anxiety driven. And then you have things like Wellbutrin that are sort of like an atypical antidepressant. So we gear our medications towards symptoms when we're prescribing things. We want to know, does someone have panic attacks? Do they have anxiety? Do they have depression? What's the combination? Do they have bipolar? There's another sort of in that mixed category. And then we often will refer people to therapy and say, well, you need to see a therapist and talk about what's causing the stress that's leading to your anxiety. But the integrative approach is really different, because we also use conventional medications, but we try to figure out what's causing the anxiety, because ultimately what the goal is to get people off of those medications, to not have them on their lifelong. If it's something like I mentioned, my patient who had a vitamin D deficiency of 9, we gave her vitamin D and she was better. Like, she could have been on Paxil forever. And it's really about trying to find the cause of what's causing her anxiety and not putting her on a medication to treat the symptom. So we use a lot of different therapies. We use therapy still, like psychologists. We use diet recommendations. We look at exercise, activity, supplements, and herbs, which is a big component. And then mind-body practices. Believe it or not, there is a ton of research, and I didn't know this till I did my 2-year fellowship. There's so much research looking at breath work, literally breath work. If you did breath work for 30 seconds to a minute twice a day, you can lower your heart rate. You can lower your high blood pressure if you have high blood pressure, and you can treat effectively anxiety. And it's amazing how many things that we don't use in the conventional world that can be so useful for patients, because a lot of patients that come to me are wanting to not be on medication lifelong, or they want to be on, say, a small dose of, Paxil or whatever, and have these together so they can kind of figure out how to treat it and then eventually get off medication. So an integrative approach, and this is a really busy slide, but I kind of broke it up into a couple of segments. An integrative approach to anxiety is really trying to find, first, the cause. 2, then let's make our approach based upon the cause for treatment, ultimately knowing that we want to try to get the goal to get people off medication. Now, some patients don't want to be off of that, and I've worked with patients who wanted to be on the lowest dose possible and still were working on other things, and that was their goal, and that's totally fine. So when we look at trying to find the root cause, we want to kind of look at different categories. So this is where that long history is really important, to ask patients, could you have some evidence of brain trauma in the past? Did you have an accident to your head? Have you had some sort of traumatic event? Now, and even traumatic event from a life perspective. There's a lot of good evidence to suggest people who've had traumatic childhoods or who have been raised in a very traumatic household have higher chances of anxiety and depression, and any mood disorder, really, behavioral disorders, ADHD. And so then you have to take in that history into part of it, because you want to know for their treatment, what can you do to that particular thing? So I put in here this slide, again, from my friend, Dr. Laura, who's great, who we talk about sort of based upon the cause. So in the top slide, it may be a little small. That's the one but disadvantage of having the slides on the StreamYard, is that the top, when we talk about sort of the childhood traumas or thought patterns that might be causing anxiety, then things like cognitive behavioral therapy are really, really effective to try to change those thought patterns and to figure out how you can change the perception of what is going on. Then we look at, and so that's sort of the thought patterns and the other component in this slide is really about toxins. I did not appreciate how much that heavy metal toxin exposure can actually affect people in mood disorder. This is actually, I think I put on that slide. Yeah. So I don't know if you've seen this documentary or not, but it's fascinating, called The Bleeding Edge. It is actually a documentary on Netflix that talks about one particular patient. He's an orthopedic surgeon, and he had a hip replacement. So he puts hips in and puts in artificial hips, and he had one done on him, and it was a metal to metal hip. So the socket and the joint were both metal, and they were made of cobalt. And interestingly enough, he had psychotic episodes after he had his hip replaced. And it took him years to figure out, and he ended up doing toxin heavy metal testing, which is very easy to do now. And now they actually have kits you can do at home, and found out that the cobalt from the hip replacement was causing him to have all kinds of mood disorders. And I find that fascinating because it was never something I did in conventional medicine. And I've done this now a few times, done heavy metal testing for people, and found so many things that, I was not aware of that caused some of their mood disorder. So it's something to definitely be cognizant of. If you feel like you have been in a job or been exposed to heavy metals, then you should definitely consider being tested for that. And then toxins, there are a lot of toxins in the environment that can cause problems. Certainly, we talk about mold and Lyme. But interestingly, there's a lot of good data looking at long haul COVID. I don't know if people know what this is, but long haul COVID, I'm going to do a presentation on this because there's so many good alternative holistic approaches for treating. Long haul COVID means that you have had symptoms of COVID more than 3 months. So you have persistent symptoms of COVID, because really we're sort of looking at this 90-day. And so people who have, like, say, long-term problems with fatigue, joint pain, nerve pain in their feet, their sense of smell and taste haven't really come back. They have hair loss. They have brain fog. Actually, brain fog is one of the most common. Fatigue and brain fog are the two most common symptoms of long haul COVID. Those people have essentially what they're finding in data and research now, looking at, they actually have still persistent COVID virus in their gut, causing them this sort of chronic infection, I shouldn't say the word infection, but chronic exposure to the virus all the time. So their gut is always, the immune system in their gut is always trying to react and constantly causing them to have these symptoms. If you think, interestingly, if this is something you think you have, there is a wonderful person on YouTube, just put long haul COVID. He has a ton of videos with science-backed and looking at different cytokines and how you can test yourself for long haul COVID, and how there's a lot of good natural treatments now with supplements that will help you with those symptoms. But I want to focus on hormonal imbalances because this little part here, really, because that's obviously what I do, and that's what we need to talk about for this particular thing. Because again, this topic is huge, so we can't just talk about every single thing. We need to focus on one particular thing. So hormonal balance. So I think this is really important. I put this in here because, I see patients who often feel like they're not getting better with their anxiety despite an SSRI like Paxil or Prozac, and they feel like, it's their fault. Like there's something wrong with them. Why can't I feel better? The doctor says I'm going to feel better. I don't, or I feel better for a month or two, and now I'm back to having the same symptoms. And it probably is your hormones. It's probably a problem with hormonal imbalance and not you. And it's your biology. And I think it's so important that people understand that it's like, a lot of times this is something you can't control. You can't outwill your hormones to be better. If it was, I would have done that 12 years ago when I had problems, like sheer willpower. So I just want to remind people that there are a lot of neurotransmitters or hormones in your brain. All of these things do particular things. So we sort of think of serotonin as our mood hormone, dopamine as our pleasure, adrenaline, fight or flight, like we want to get out away from the bear, we need to run away from it. Noradrenaline is used is sort of thought about as concentration. This is where some of those SNRI medications work to improve. So, and then serotonin obviously is the SSRI medications like Paxil, Prozac, Celexa, Lexapro, all those. GABA is the excitatory hormone neurotransmitter but also tends to sort of help us relax when we need to. Glutamine is the memory. This is also a lot of new data talking about Alzheimer's. How can we improve our glutamine or our memory? And then endorphins, like, so the euphoria symptom, the neurotransmitter that helps with sort of relating pleasure with an activity that you did. So particularly talking about hormones and what we do or what I do in women's health, serotonin, dopamine, and cortisol are kind of the three biggies, because they affect the prefrontal cortex, which is the part of the brain that sort of helps us with thinking, with our social behavior, with our personality. But I'm going to talk really about serotonin, because this could go for 2 hours if I start talking about every single one of these hormones. And particularly about generalized anxiety disorder, because the 3 people that I talked to this week in my practice, it was all generalized anxiety disorder. And those are sort of what doctors typically describe as sort of the worry warts, the people that worry about everything. So they're all day feeling anxious and worried about what's going on. And this is the reference that I'm using for talking about which neurotransmitters are in balance. But when you look at brains, both by imaging and MRI, and also just the blood levels, you can see that in general, women with generalized anxiety, or men and women, but women here we're talking about, with generalized anxiety disorder have a lower serotonin level, an upregulation of their GABA, their excitatory pathway. And the norepinephrine pathway is sort of mixed results. Sometimes it seems to be up, sometimes it seems to be down. And that's sort of the concentration component of the neurotransmitters that we were talking about. And serotonin, again, known as 5-HT, is a hormone that functions as a neurotransmitter to carry signals between the nerve cells of the neurons. It's involved in a lot of processes, mood being one, but sleep, digestion, sexual health. I mean, a ton of things serotonin involved. There are a lot of serotonin receptors in the gut, a lot of serotonin receptors in the brain. That's that gut-brain axis that we're always talking about, or that, most of us are always talking about. And so one thing I really wanted to point this out, because I think I'm going to sort of talk about a couple of examples. And what's really important to understand is that estrogen receptors are everywhere. Estrogen receptors are found on every part of every organ of our body, but particularly in the brain, estrogen receptors are really important to make neurotransmitters. You cannot make serotonin without proper estrogen. And that's really, really important, because from tryptophan, you make 5-HTP, serotonin, and melatonin. Melatonin is your sleep hormone. So if you're not having appropriate serotonin levels, you're not going to have appropriate melatonin levels, which makes sense, right? You hear about patients who say, I know I have a mood issue, I have anxiety, but I also can't sleep. I can't get to sleep. Or when I'm sitting there like, no, let's see, I got the grocery list, I got my kids, they have a difficult time getting to sleep. And it makes sense. It's in the same pathway. And these particular production of hormones require certain nutrients. Magnesium is actually present in 2 of those steps. Vitamin B6, folic acid, and iron are also hugely important. So when I mentioned to you that I've seen patients with nutrient deficiencies, I did their blood work, or I had them do an organic acid test, I would see these low levels. And then, replacement will often fix them, and they not fix that, but will help them with their anxiety, and they don't need as much medication. That's really, really, really cool. Like, to think about how you can fix this by either diet or diet and supplements, and then ultimately not need medication. If you have too much estrogen, if you're an estrogen dominant person, you often go down this pathway and not making appropriate serotonin. This is actually byproducts and often leads to people having, a poor mood. So it's the opposite pathway. And this is important when we talk about sort of examples. So those 3 patients that I saw, I'm obviously not going to talk about them particularly because I protect their anonymity. But one patient was a person who has PCOS. She has high estrogen and low progesterone. Well, if she has low estrogen and does not have enough to make the hormone and the neurotransmitter serotonin and melatonin, then you're really not, she's not making the appropriate amount of hormones. So of course her mood is lower, her sleep is disturbed, but you can't simply just give someone estrogen, because artificial estrogens are not the same as endogenous estrogens. 1, 2, you're really let me go back to that slide, because I think that's important to see. When you do this, it still doesn't account for, you're making 5-HTP, but are you really making the appropriate serotonin level? And that's not always correlated with just like slamming someone with estrogen. It's very easy to go from this pathway to this pathway. So it's a delicate balance. It's not like estradiol is in different, here's 1 milligram and 1.2 milligrams and 1.3. Like, you can't titrate it like that. You oftentimes have to figure out, what is it that I can do to help the body make its own estrogen to help fix this problem. So on this particular patient, I looked at her nutrient deficiency. She actually had very low magnesium levels and very low vitamin B levels. B12 is typically what we look at. You can do a organic acid test, which can give you more details. That is a functional medicine test not provided by traditional doctors. And you can sort of get more at the micronutrient level to try to figure this out. Zinc levels are really hard to test for. Blood zinc levels. Zinc is very hard to sort of detect in blood, but there is a blood test for that. And so on this particular patient, what I did was actually give her an herb called shatavari, which is actually an adaptogen. So it helps her body adapt to the stressor, adapt to this change to kind of keep her even keeled. And then we were able to, her high estrogen level, give her progesterone and through chasteberry. And then she was actually already still on a SSRI. So over time was able to sort of let her body start making the appropriate amount of estrogen, and then she was able to wean herself down off of that particular SSRI. And obviously optimizing diet and nutrients, because gut health is hugely important in this, and most of us, including myself, can always use some improvement in our gut health. So making sure that she's, taking, on this particular patient, we worked on trying to get nutrients through her diet as opposed to relying on a multivitamin and try to up that. So trying to get, like I mentioned, zinc in her diet, vitamin B, and then magnesium. I am a huge fan of magnesium. There's very, very, very little side effects of magnesium. Now, there are a lot of different types of magnesium. So I'm talking about magnesium for brain health, which is L-threonine. Magnesium glycinate can also work, but not magnesium oxide is not particularly used. And so there are certain magnesiums that are used for helping you have a bowel movement or helping you get things moving on your gut. And there are other ones that are sort of more optimized for brain health. So I almost always have patients with PCOS on magnesium because it does help. I will say, I probably should say this, is that I'm talking about supplements and these things, and obviously I'm not speaking specifically to you, that you need to always make sure that your doctor is aware of what you're taking and what supplements and herbs that you use as well, because it's important that the bigger picture, some things interact and can't be used together. So for this particular, here's PCOS. So this, here we go. I put this in because I think this is really important. So the normal mechanism of PCOS actually is because you have this sort of pulsatile GnRH, high LH. And this often causes a lowering of dopamine, which is the reward hormone, serotonin, which is your mood hormone, your happy hormone. And then ultimately this low serotonin level is basically worsened by insulin resistance to begin with. And GABA, which is sort of your excitatory hormone that can sometimes calm you, but a lot of times sort of get you going, that can actually be worsened by high androgen levels as well. So unfortunately, PCOS, a lot of times it's sort of the snowball effect. You're kind of coming at it for different angles. So a lot of times you need to actually look at the underlying issues. I often with PCOS patients check their insulin resistance labs or inflammation labs, try to figure out where is it that we can fix the pathways so that we're not causing lowering of serotonin levels. And by just fixing the drivers of their PCOS, a lot of times their mood gets better, which is fantastic. Because why treat, I know that you guys know that I'm big into treating PCOS, but why give them an SSRI for depression, metformin for their insulin resistance, a birth control pill for their hyperandrogenism or spironolactone? I mean, it's like you're just constantly giving, here's medication, here's medication, here's medication, here's medication, and really not treating the underlying issue. Okay, I'm off my soapbox. Okay, second patient I saw this week, second and third patient, one was perimenopausal patient, and one was a postpartum patient. She had delivered within the last couple months. And so both represent a low estrogen state. Perimenopause, the ovaries are getting, it's harder and harder for them to make the appropriate estrogen to counteract the progesterone level. And obviously everything is sort of going down. Postpartum, you're in a low estrogen state on purpose. And so oftentimes that means low serotonin and low melatonin, both. So you can replace estrogen. You can give someone estrogen, and give them a birth control pill postpartum, but A, it will dry up their milk if they're breastfeeding. And two, you're really not fixing the problem. Again, you're just fixing that one arm of the pathway. And you can also give them an SSRI, which works perfectly fine. But on this case, the patient wanted to have a more holistic approach to her anxiety and try not to be reliant on a medication for a long time. So looking at same thing as the PCOS patient, look at nutrient lab deficiencies, lab work, like could there be let's look at the estrogen, progesterone, testosterone levels. And then cortisol, which I didn't mention, but cortisol really stress really drives all of these hormones to be out of whack. So you can literally have everything else in place, but if your cortisol level is sky high because you're running on fumes, it's going to disrupt all of this. And for this particular patient, I gave her shatavari as well. It's safe in, it's an Ayurvedic herb, by the way, if you don't know what it is. It's meant for adjustment or adapting. It's an adaptogen, and it's been used for thousands of years in Ayurvedic medicine. Basically, it's safe in breastfeeding, so we used that one. I also gave her a information for magnesium, L-threonine, also safe in pregnancy and postpartum, and very helpful for it helps to relax you. It brings you to a relaxed state without making you tired, as opposed to a benzodiazepine like Ativan, which kind of really suppresses your makes you sort of tired and relaxed. This is actually just not doesn't make you tired essentially. And then we talked about optimizing diet. And then I'll talk to you the last thing, which is the mind-body approaches that I also recommended. Same thing with the perimenopause patient. I put this up there. This is a really complicated slide. But again, if you don't have any way of testing, you don't know, like, is their estrogen low? I'm sorry, there are 3 forms of estrogen, right? So estradiol, estriol, estrone. Is it low, or is it too high of testosterone, or is there DHEA too high, forcing the pathway to go down this way? Where is it? So testing is really important. So steps for how to treat holistic anxiety. Well, holistically, how to treat anxiety. It's really important to find the cause. So a good history. Have they had trauma to their brain? Have they had childhood trauma or events that could have led them to, have they had anxiety since they were young? Was there a particular event related to it? Have they had any toxin exposure, heavy metals especially? What is their gut health like? If they have a ton of digestive issues, bloating, constipation, almost always, if you fix their gut, you're going to fix their anxiety. Nutrient deficiencies are important to look at. And then hormones, the sex hormones, and certainly cortisol. If someone comes to me and they say, I'm always wiped out all day and I cannot sleep, it's almost always cortisol driving their anxiety. So it's important to test for that. Next up, if you just didn't test and you just wanted to start something, an anti-inflammatory diet, super important, with a good multivitamin. If you don't eat very well, if you don't like vegetables, if you don't like to sort of be adventurous with plants, then you probably should have a good multivitamin. You should also have a good B complex. I think I showed you, I don't want to back it all the way up, but one of the first slides was that vitamin B6 is part of almost every pathway for neurotransmitters to make those hormones. So if you don't have adequate B vitamins in your diet, then you need to get it through a B complex. And B complex usually has B1, B6, B12. B12 is good for energy. And so it's important to get a good B complex vitamin. Omega-3s are fish oils. Omega-3s can be in fish oils or a flaxseed, both of which at 1,000 milligrams a day have definitely been associated with a lot of mood disorders. In fact, ADHD. There's a lot of studies looking at right now with ADHD, and could you just give someone omegas? And that's actually what I have my son on, is the fish oil to help him with his ADHD, and it has helped with sort of brain focus. Essential fatty acids come from fats, healthy fats. So avocado, coconut, healthy fats in your diet. You can get the essential fatty acids you need to make those hormones. Magnesium, I mentioned this, there's almost like no downside to magnesium. If you pick the magnesium for brain health, which is magnesium L-threonine, not mag oxide, or maglycinate is also good for brain health, then you can be on those. There's very rarely any side effects to magnesium, and it can oftentimes help people just kind of decompress or relax to help them not have that fluttering feeling and those anxiety feelings, because again, it's needed for making a lot of those neurotransmitters. I only talked about serotonin, but it's also essential for dopamine. And so it's really important to sort of make sure that you have magnesium. You can get blood tests for magnesium levels as well to see where you are. Not conventionally used. A lot of primary care doctors do not do mag levels, but it is possible. And then vitamin D. Vitamin D, really, really, really important to be checked. Vitamin D levels have definitely been associated with anxiety as well. And then gut health, a good probiotic. I mean, if you're really good at eating and you have a great diet, do you need a probiotic? No, but most Americans, including myself, often can benefit from a probiotic to have the good bacteria back in the gut and to make sure that you're absorbing the nutrients from your food because you have the appropriate bacteria in there. It's a relatively minor thing to add for most people. So, here we go. Magnesium L-threonine. So I just put this dose. Some people actually take it in the natural form, which is green tea. We'll take, 2 cups of green tea a day. It's sort of up to how you like to get your supplements. If you like green tea, really, it's great for relaxing you, but you can still remain alert. So it doesn't interfere with that. There are some prescribers who use neurotransmitters who literally from that pathway, they actually go and give you 5-HT or GABA or tryptophan. I don't use this quite as much as some people because oftentimes I find an underlying cause. So I don't really need to give them that particular neurotransmitter. I really want the body to be able to do it themselves long term. I brought this because I put this slide in here because I think this is really important to highlight magnesium. So not only is magnesium used to make 5-HTP, but it's also used to make serotonin, also used to make melatonin. So it's part of the entire pathway. And oftentimes I see this with perimenopausal women who will say to me, like, I can't concentrate. I'm having a hard time sleeping at night. I only sleep for like 3 or 4 hours at a time. So oftentimes we start with magnesium supplementation. And sometimes then I add herbs like SAMI, which is right here, or hops, which is a great one for women who wake up in the middle of the night due to their sort of disruption of what's going on as they transition into menopause. So this is kind of like one of those things that kind of works on a lot. And really, why does it work? Well, we're really magnesium deficient in the United States. We used to have really mineral-rich soil, and now over the years, things have changed to where we're trying to get, wheat faster and faster and faster. The cycle of growing wheat has gotten much shorter, and so the soils are really deficient in a lot of vitamins and minerals that they used to have, and magnesium in particular. Add herbs. So I put these little asterisks because these are ones you cannot take when you're pregnant or breastfeeding. So Calmade, actually, lavender I often use the lavender essential oils for people who have anxiety. They're great to sort of put along your temples. There's a supplement called Calmade, fantastic, has lavender, very easy to use for the calming effect. Passion flower, chamomile, both fantastic. Valerian root is great for women with perimenopause. It actually is good for sleep. Fantastic. Kava is really good for panic attacks. So it's actually a very quick acting. I have a mentor who actually uses it to make kava cocktails. She makes kava pina coladas to help calm people down. It's more of just sort of a fun. She teaches residents and stuff, so she often comments about her kava cocktails that she makes. And then lifestyle. So sleep. If there's anything you can do for anxiety is to make sure you're getting 7 to 9 hours of sleep. Sleep, like I mentioned, the melatonin, right, is hugely beneficial for trying to help with anxiety. Exercise daily is very important. A lot of good studies looking at exercise, and not necessarily running, but any exercise where you're moving your body daily for 30 minutes, improving mental health, relationships, having social network or community, acupuncture and therapy. Certainly all of these things are sort of lifestyle choices. And often when I talk to a patient, we talk about what would they like to add from a lifestyle standpoint. And then mind body practices. So this is something I really, really, really believe in because I have noticed how much it's helped myself, my 10-year-old who had bad anxiety from moving across the country. Breathwork is really, it's amazing how beneficial it is. What it does is try to take you from a sympathetic or a fight or flight response to a parasympathetic rest and digest. And it's very simple. There's a lot of different ways to do breath work. Really, it can be very simple, like a minute twice a day, like literally that simple. Dr. Andrew Weil, who's the one who leads my fellowship, does a 4-7-8. I'm literally going to do it right now just because why not? It's, 6 p.m. So basically the 4-7-8 is you're going to take a deep breath in for 4. You're going to hold it for 7. You're going to release it for 8. So it's literally that simple. You're going to take a deep breath in, hold it for 7. Out for 8. You're going to do that for 30 seconds minimum. Minute would be great, although most people take time to practice to get to that. 30 seconds twice a day. Very good data looking at lowering people's heart rate, lowering their blood pressure, helping with their cholesterol, helping them with their mood disorder. Such a very, very easy intervention. And honestly, I've used it a few times when I had a really stressful situation with delivering babies. I've had a situation where I know I'm going into a very, stat C-section. I take 10 seconds just to do it a couple times and really kind of diffuse, lower my heart rate. And I've noticed how much more I can focus, and I feel like I'm a little more grounded and not so amped up. So it's really good for in the moment, super good for sort of diffusing those situations. Yoga, meditation, vagal nerve exercises. You can go to YouTube and check out what that means. But those are also great mind-body practices. Oh, I should have grabbed, let me do this real quick. Oh, I'm gonna grab this book. Sorry, I just thought of it. This is a book I love to recommend. Stress Relief Survival Guide by my friend Leslie Koenig. Dr. Leslie Koenig, she is a trauma surgeon, military, wonderful. I don't get any money from it, just so you know. This is really a book that's so fantastic because it has so many techniques, and actually she breaks it down into different levels of like high alert, low alert, medium alert, about what you're feeling at the time. Like if you're having a panic attack and you need the red, the critical, she has particular exercises that actually go through and help you in that moment. So it's really good. I've used this with my kids. The tapping is really fantastic. I've done tapping. We've done she has this wrist exercises that's great. So Leslie Koenig, Stress Relief Survival Guide, really good if you're looking for something to kind of start figuring out what works for you, because that's really what's most important, like what works for you. Something like breathwork might work for me, but you may not like it. So it's really great because it has, 20 or 30 exercises that you can really kind of figure out what works for you. Okay, so I know I'm going over again as always. So if you're in my membership, if you're a patient in my practice, then we have a members only office hours every Tuesday. So we pop over to that Zoom link and you can ask me whatever you want. We can talk about, remember it is not recorded. It's really just a private time for us to sort of connect and talk with other people in the community to figure out what else that you need to support you. So if you are a member, then pop on over to the Zoom link. I will not be here next Tuesday because it is my birthday. So I'm turning 39 again. So I will not be here next Tuesday because I will be eating red velvet cake, undoubtedly, because that's my favorite. So then I will pick up the week afterwards, and I have a special guest. She is a holistic nutritionist. She is probably going to do a demonstration. I think we talked about some easy breakfast options because that's come up a couple times recently about easy breakfast options and how you can kind of make healthier choices. So I hope you all have a wonderful night, and I'll see you in 2 weeks.